They are known to be abused and create addiction, and they're considered a gateway to heroin. And now there is a new poll from Michigan's C.S. Mott Children's Hospital that suggests that some parents mishandle leftover painkillers. Joining me now is Dr. Matt Davis, and you are talking about this new study. It's a poll that really takes a close look at, of course, we know there's this significant spike in overdoses due to painkillers, but what are people doing when they actually get a prescription for these medications? What happens to them if they don't use the entire bottle? What happens to that medication? So talk to us about some of the findings in the poll.
What we found, Rhonda, is in this latest national poll on children's health, over 1/3 of parents said their kid age 6 to 17 was prescribed some form of painkiller, and in the majority of cases those were opioid or narcotic painkillers for a surgery, a dental procedure, or maybe an injury like a broken arm. In over half of those situations, there were leftover medicines. And the question is, what was done by the parents with those leftover pills? We know leftover pills can be a big problem in terms of especially teens getting access to them,
right,
or even younger children mistaking them for other medications. So the best thing to do for parents is to take those medicines back to the pharmacy, for example, but fewer than 10% of parents had actually done that.
Well, I don't think, I mean, even for a parent getting a prescription, let alone for a child, that many even think to take the leftover medication back. So is that conversation supposed to be happening between the doctor and the patient?
Great question, and in fact it sounds as if from this national poll that conversation isn't happening often enough. What we found is that parents who said that their children's healthcare provider had talked with them about what to do with leftover pills were much less likely to have those pills in the medicine cabinet at home.
So let's talk about just the dangers then of having these medications in the home after whatever pain or illness has subsided.
The dangers really boil down to two things. One is mistaken use, so using these medications, let's say, for a routine painkiller like Tylenol, when in fact they contain this opioid component and can spell trouble for a person in terms of being sedated or having other problems that come up as a result. The other problem that comes up is misuse, which can boil down to using them for recreational drug use or selling them to other youth that can fuel the opioid epidemic that we're seeing nationwide today.
Yeah, so this is a big warning to parents to make sure that you dispose of it properly, and taking it back to the pharmacy is a great way to do that.
And it's about working as a team between parents and providers to make sure that we have a plan with what to do with those leftover pain pills.
All right, Dr. Davis, as always, great information. We appreciate all the studies they do over there at Mott. You're always working on something, so we'll see you back here next month with the next one.
It's a pleasure.
All right.